This week on Healthy Living, experts sound the alarm on the shortage of blood supply globally. And Uganda steps up efforts to increase blood donation in the country. Plus, Zambia rolls out a new HIV prevention medicine. That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. A blood transfusion can be a patient's lifeline, whether it is to treat medical emergencies, support surgeries, or aid patients with chronic illnesses. The World Health Organization reports that every few seconds, someone somewhere needs blood. However, less than 1% of the population donates blood regularly. Blood donation is a voluntary procedure. A single blood donation can save up to 3 lives, according to the U.S. National Institutes of Health. Observers say many countries in low-income settings, including in Africa, struggle with collecting blood and storing blood. Reporter Mugube Davis Rakarinji has more from Kampala, Uganda.
Students at Kororo Secondary School in Kampala donate blood at temporary Red Cross blood collection center. 18-year-old Juliana Mutoni says, like most of her peers, she was worried that giving blood would make her unwell, but she found out that didn't happen.
What motivated me to donate blood today is to save the lives of patients who are out there, who are suffering from different diseases, so that they can regain their lives. And right now, I'm feeling well. I don't have any health difficulty, because even right now I can jump, I can walk, I can do anything I want.
Uganda Red Cross says students donate at least 70% of blood collected. Dora Mbanya, a professor of hematology at the University of Yaoundé in Cameroon, says many people in African communities are skeptical about donating blood.
In some situations, people have to be affected directly for them to get up and go donate blood. They are so misinformed about, so many myths about blood transfusion. Some say when I give my blood, you take it and you take my charms, my blessings with it. And so because of that, they wouldn't give blood. Others don't even understand why they should be altruistic. They think, oh, I give my blood and later on people pay for it.
The World Health Organization says just half of the blood needed for transfusion each year on the African continent is collected, leaving many facing life-threatening shortages. In early March, dozens of experts from 40 African nations met in Kampala to discuss ways to dispel fears and boost blood donations. Dr. Diana Atwine, the permanent secretary at Uganda's Ministry of Health, outlines why Africa has to improve its blood transfusion services.
We are talking about high disease burden in Africa, malaria. We are seeing more cancers on the rise. We are seeing sickle cell, road traffic accident, mothers delivering and requiring blood. And so all those put a lot of pressure on the blood services in the country.
Delegates agreed to streamline safety procedures for collecting and storing blood. Sarah Mutegombwa works for the Uganda Red Cross Society.
We are still having few people that donate blood, and we want to look for regular blood donation. You don't donate once and disappear, but you donate regularly.
She says health officials at the Kampala meeting agreed to work to demystify blood donations and blood transfusions. The delegates also agreed to reduce the need for blood transfusions by pushing to prevent diseases and road accidents in their countries. For VOA News, I am Mugume Davis Rwakarinji in Kampala, Uganda.
We wanted to know if you are a blood donor and if someone you know has ever needed a blood transfusion. Here are some reactions from Facebook. Kennedy Sitati from Kenya says, I have donated blood on numerous occasions, mostly accident victims, sometimes responding to blood request appeals on newspaper, TVs. But I decided not to continue with donating blood for health reasons and the fact that the system let me down when a relative could not be saved for financial reasons even after donating blood. Augustin Kabanda in the DRC writes, I'm not willing to donate blood to anyone because if you start to get sick and need blood, who will help you then? I know if you are given blood, you have to eat good foods, which is expensive. And Marwa John Paulson from the DRC says, I have never volunteered to give blood to anyone, but if I am educated on the importance of doing so without health consequences, I'm willing to take part in the exercise. And finally, Shukuru Mbole Darius from Tanzania writes, I am willing to make the sacrifice to save someone's life because he has the right to live just like me. Dr. Cynthia Chimonges is General Secretary, East Africa Division of the International Academy of Pathology. She discusses the challenges of blood donation and what can be done to increase the blood supply in health centers.
So blood donation, it consists of a voluntary act of giving blood to be used for transfusions or medical treatment. The moment a donor arrives at a facility for blood donation, and most of the time it will be a blood donation center, there is usually a questionnaire they're given to as an initial screening to determine if they're eligible for transfusion. This will include the age, usually look is between 18 and 65. We look at the major general health of the patient. It is usually held in private. Privacy and confidentiality is maintained. From there, the eligibility is determined initially at that phase. Then the next step, should they meet the criteria, then the blood is taken for further analysis. So the blood samples will be drawn and also for testing, as well as the blood from the donor, usually about 450 mils, is drawn about for 10 to 15 minutes. Even after the donation, they're given refreshments to replace the volume that has been donated. And that takes about almost 20 minutes to ensure the patient is stable by the time they leave. Now, the process of screening for infectious diseases like HIV, hepatitis B, hepatitis C, syphilis is done. And this is now where the second screening, or rather eligibility, is confirmed if this blood is actually going to be used for transfusion where it is needed. So we have the Kenya National Blood Transfusion Center that centrally coordinates these processes and policies that are now will be followed by these transfusion centers. You have 6 regional centers in Kenya and also 25 satellite centers. So through this mechanism, the need for blood is made aware, and also so that where blood is needed, it is transported accordingly. In my perception, why we need to give blood, because being a living tissue and with a limited shelf life, we need consistent a pool of blood donors. And also, as per WHO regulations, we need at least blood in our blood banks, about 1% to 3% of the total population. That means in our setup, we need about 550,000 units. Currently, the highest we've attained since the National Blood Transfusion was set up in 1998 after the bomb blast is the highest we've recorded in 2021 was about 40% of the requirement that we have. So we still have a long way to go. We still have a shortage in terms of what we need as per WHO requirements. And so we definitely need to have more of donors. We need to have more donors in our setup. The maximum that can be for males that can they can donate is around 4 times a year, and for females, because of the menstrual cycles, so the blood they can donate can be up to three times a year, and also some given that females also to do with pregnancy and lactation, there might be the donation at that particular point might be deferred even if they're willing to. So we'd have more donations coming from the males in a year compared to the females.
A new report by the United Nations reveals that the number of children who died before their 5th birthday has reached a historic low.
The United Nations Interagency Group for Child Mortality, or UNIGME, estimates that the global under-5 mortality rate has declined by 51% since 2000. Several low and lower middle income countries have outpaced this decline with a reduction of 75%, including Cambodia, Malawi and Rwanda. In its new report, UNIGME says this progress is possible when resources are sufficiently allocated to primary health care, including child health and well-being. But the findings also show that despite this progress, 4.9 million children died before the age of 5, half of them newborns. The lives of 2.1 million children and youth between ages 5 and 24 were also cut short. Most of these deaths were in sub-Saharan Africa and Southern Asia. At current rates, 59 countries will miss the Sustainable Development Goals under 5 mortality target, and about 35 million children will die before reaching their 5th birthday by 2030. This is primarily due to preventable or treatable causes such as preterm birth, complications around the time of birth, pneumonia, diarrhea, and malaria. The experts say many lives could be saved with better access to high-quality primary health care and low-cost interventions such as vaccinations and diagnosis and treatment of childhood illnesses.
Zambia has received the first shipment of a new medicine to prevent HIV infection. The delivery makes Zambia only the 2nd country in the world after the United States to offer this injectable preventative outside of a research setting. Kathy Short reports from Lusaka, Zambia.
For 2 years, Precious Mbomboli took pills daily to prevent infection with HIV, the virus that causes AIDS. But the 21-year-old is among the first in Zambia to receive a new injectable prevention drug.
For 2 years, yes.
I changed the new injectable on 25th February because the pill was difficult for me, as I used to forget to take it. Sometimes I was not at home at the time of taking the medication, so the injection makes me feel better and confident.
The new drug is known as cabotegravir, long-acting. Each shot prevents infection for 6 months. Zambia is the first low or middle-income country to offer the drug to the public. Lina Mwango is technical director of the local non-profit CHEP Zambia.
Our target age group for this is adolescent girls and young women who are aged 16 to 24, as well as we're reaching out to their sexual partners.
Local representatives called connectors are helping roll out the program.
The connector is based in the community. We do community mobilization, we do community sensitizations, we go on screen the girls that are eligible for dreams, those that are eligible get to be enrolled.
The U.S. government has donated nearly 15,000 vials of the drug known as cabotegravir. That's enough to protect 2,000 Zambians against HIV for 1 year, the U.S. Embassy says. But experts say people who get the shot still need to take precautions.
People get the injection and then they think it's a silver bullet, in that then they can go out and sleep around. And really the message here is that that's not why this drug has been brought on board. To realize that this drug does not prevent pregnancies, it doesn't prevent other sexually transmitted infections.
About 1.4 million Zambians are living with HIV, with about 33,000 new infections per year. Experts hope the new drug can help bring those numbers down. Kathy Short, VOA News, Lusaka, Zambia.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linor Mudu. Until next time, stay well and strive to make every day a healthy day.